Cholera is a serious bacterial infection. It affects the intestines and can be fatal if untreated. The bacterium, Vibrio cholerae, releases a toxin. This toxin causes severe diarrhea and dehydration. Cholera has a long and devastating history. It has caused numerous pandemics, mainly affecting areas with poor sanitation. The disease spreads rapidly in places where clean water and hygiene are lacking. Cholera is a major public health concern, especially in developing countries. Understanding the disease, its transmission, and preventive measures is crucial. By taking necessary precautions, we can protect ourselves and our communities from this preventable illness. Cholera spreads primarily through contaminated water and food. When human waste comes into contact with water sources, it contaminates them with the bacteria. This can happen due to inadequate sanitation systems, open defecation, or flooding. Consuming contaminated water or food is the most common way to contract cholera. The bacteria multiply in the intestines and produce toxins that lead to the disease's debilitating symptoms. Preventing cholera transmission relies heavily on access to clean water and sanitation. Proper sanitation systems, including toilets and sewage treatment, are essential to prevent contamination of water sources. Safe hygiene practices, such as hand washing with soap and water, particularly after using the toilet and before handling food, are crucial in breaking the chain of transmission. Cholera infection can manifest with a range of symptoms, from mild to severe. The incubation period, or the time between exposure to the bacteria and the onset of symptoms, can vary from a few hours to 5 days. The most prominent symptom of cholera is profuse, watery diarrhea, often described as rice water stools. This severe diarrhea leads to rapid dehydration, which can be life-threatening if left untreated. Other common symptoms include vomiting, muscle cramps, and weakness. In severe cases, individuals may experience extreme thirst, dry mouth, sunken eyes, rapid heartbeat, and low blood pressure. Recognizing the symptoms of cholera early is crucial for prompt treatment. If you or someone you know experiences severe diarrhea and dehydration, especially after potential exposure to contaminated water or food, seek immediate medical attention. Section 4. Practical tips for cholera prevention. Preventing cholera involves safe water, sanitation, and hygiene practices. Adopt these measures to reduce your risk of contracting the disease. Boil water for at least 1 minute to kill cholera bacteria. If boiling isn't possible, use water purification tablets or filters. Wash hands with soap and water after using the toilet and before eating. When traveling, be cautious about water and food. Stick to bottled water. Cholera outbreaks. A stark reminder. These outbreaks highlight the importance of sanitation and hygiene. They often occur in areas with poor infrastructure and sanitation. Yemen's ongoing outbreak, since 2016, shows the impact of conflict on water systems. Haiti's 2010 outbreak, post-earthquake, revealed vulnerabilities in disaster-stricken areas. Investing in water and sanitation can prevent future outbreaks and save lives. Section 6. Conclusion. Your health, your responsibility. Cholera is a preventable disease. By understanding its causes, modes of transmission, and preventive measures, we can protect ourselves and our communities from this deadly illness. Access to clean water, proper sanitation, and good hygiene practices are the cornerstones of cholera prevention. Boiling water, using water purification methods, washing hands diligently, and consuming safe food are essential steps to stay safe. Remember, cholera can be fatal if left untreated. Recognizing the symptoms early and seeking immediate medical attention is crucial for successful treatment and recovery. By taking responsibility for our health and advocating for improved sanitation and hygiene in our communities, we can contribute to a world free from the threat of cholera.